On a lighter note about hernias, I would like to share some of the interesting facts about hernias, which may be of interest to general public, patients, or young medical students. Hernia has been recognized for a long time with its complications and various treatment modalities. However, what was mentioned by Sir Ashley Cooper in this great book of Pain and Love that they've written, he states that no disease of the human body belonging to the province of the surgeon requires in its treatment a better combination of accurate anatomical knowledge with surgical skill than hernia in all its varieties. And that holds true. Hernia is challenging, anatomy is difficult, though this is one of the commonest early operations on which the surgeons are trained upon. However, it takes years to master, and it's very difficult to get consistently good results. In open hernia surgery, there were various techniques used to deal with this disease, and there were various methods from Vicini's to Darling's, Halsted, shoulder ice repair, and then finally Liechtenstein repair that we perform nowadays with the mesh. All had their strengths, their weaknesses, and the challenges, and were difficult to master. I was very fortunate to be trained in the era when we were not using any prosthetic material, and we had to use the human tissue in the best possible way to strengthen this area. And that allowed us to understand the dynamics of the groin, how it works, how we could maintain the flexibility and avoid the risks and complications, still maintaining the strength or the area strong enough to deal with extreme forces which can be applied to this area at the time of lifting, coughing, sneezing, exercise, running, and other activity. This is a very dynamic area indeed. All the years when I was getting trained, and in my early years as a consultant as well, whenever we used to visit a hernia meeting, and I was a member of British Hernia Society as well, it was a common phrase that the surgeon would get up on the stage and he would say or state, there are many surgeons that he knew who could take his gallbladder out, but only one surgeon whom he will let do his hernia surgery. And generally one would agree that probably 1 out of 500 surgeons is a good surgeon to do the hernia operation. But interestingly, when people walked out of that meeting, all the 500 surgeons would be thinking that probably they are the surgeons who could have done a hernia on that person. Yes, surgeons can have a slightly inflated image of their ego skills or abilities. However, this is a very unforgiving operation. If not done right, there can be significant complications and problems, and those of which are very difficult to deal with. Laparoscopic approach has kind of standardized operation and has made the overall operation reproducible in the hands of different surgeons. But still, the learning curve is long, and one needs to do at least more than a few hundred to 1,000 hernia operations to become comfortable to be able to deal with all sort of hernias that present to them and their subtle variations and how best to deal with them. We personally believe that at least 50 to 100 operations done under supervision, followed by other operations done carefully on selected patients and not taking on any challenging cases, is the right way to learn this technique. I, with my boss, Professor Michael Bailey, who is a true champion of hernia in the United Kingdom and Europe, we did our best to teach and train surgeons in Britain and Europe to perform this hernia safely, and we visited their centers to set up their hernia centers and take them through operation, and we followed them up and provided them our feedback and advice if they had any issues or problems. And probably that's the right way to take up this procedure, build up the practice in this sort of surgery, and it's almost a specialist operation in its own. And here we are talking about inguinal hernia, groin hernias, umbilical hernias, incisional hernias. But when we go a step further on an internal or a hiatus hernia, then the level of expertise and the number of cases that is required is much higher than these hernia operations. We wish our patients the best for this very common operation, which is performed about 80,000 to 100,000 a year in the United Kingdom. And they are back to their life in an effective manner without any comorbidities.